And this conversation brought to you by Marcus & Mack, a law firm representing injured people. And on the line with us today, Kristie Voyda, who's the director of Bayada Home Health Care, and Kevin Means, the client services manager at Bayada Home Health Care. Let's bring them both on board here. Punch a couple of buttons, and there they are. Kevin, Kristie, good morning.
Good morning.
Good morning, Todd. Good morning, everyone.
It's good to have you both with us here today. So it is obviously this year different than in any other year, and home health care is such an important part of what's going on in the healthcare community right now, and you folks are right there at the forefront of it. So let's talk a little bit about it. More and more patients are having to be treated at home, and it's a good thing that there are agencies such as yours who are there doing it.
Yeah, you couldn't be more right about that, Todd. I think, home health care is definitely, even in the last few years, really just up and coming in terms of trying to keep people at home, whether it's, people who are older or the population that we primarily serve is pediatrics. And so I think a lot of people aren't even aware that there are so many children out there who require nursing or home health aid services in their homes, so they don't have to be institutionalized, and so their parents can work and sleep and really, conduct their lives as normally as possible.
Well, speaking of, the pandemic changing the way we do things, there's actually some changes at Bayada that you've basically shifted the whole model around, haven't you?
Yeah, we have. So, no better time to do it in the middle of a crazy year, just to add some craziness to the mix. So, like I said, we do specialize in pediatrics, and we've really experienced a lot of growth in the past 8 years, and to the point where, we want to really still have that personal touch with our clients and our field employees. So we created 2 offices from one, and in an effort to really specialize the care that we provide. So we changed our name a little bit to be more encompassing of our service area. We used to be called Indiana County Pediatrics because that's our office sits in Blairsville, which is Indiana County. Mm-hmm. However, our service area is much larger. We go to Cambria County, Somerset, Bedford, Jefferson County. We have some clients in Blair County, Westmoreland County. So in order to be more encompassing, we changed our name to Laurel Highlands. And so we have this one office now that will specialize in care for what we consider to be high-tech care. So, a lot of children, many people don't realize, have tracheostomies. They're ventilator dependent. Their bedroom or their living room at home almost becomes like an intensive care unit for them. So, again, so they can remain at home and be with their families every day. So we have one office that will really specialize in clients that are very complex in nature. And then the other office is going to continue to specialize with our clients and patients that receive home health aid services and still skilled nursing. Their care it's still complex. It just wouldn't require trach or ventilator care or more than like 84 hours a week of care, because we don't do visits. We do like what we call shift care. Mm-hmm. So our nurses are in the homes for, sometimes 20 hours a day.
Yeah. Kevin, let's talk about that from your aspect.
Sure. So right now, since the office split, our side of the office, which is called the LHP, we currently right now have 118 aides and 53 nurses and about 145 clients or children that we provide services for. And we are currently working at this moment on 18 referrals. So as Kristie said, there is a huge need out there in the community, and the referrals just keep coming. We probably get, I would say, at least probably 2 or 3 referrals a week now.
It's amazing to me the number of people that and the man hours that are required for the work that you do. And as Kristie was just talking, Kevin, that's quite the travel footprint that you have working out of your 2 offices.
It is. I mean, we have, we can't say enough about all of our nurses and aides, and especially our clinical managers, the miles they put on each day to travel, and do the visits to make sure, the nurses and the aides are, and the clients are, having the best care provided that they can. As Kristie said, we're in 5 different counties, so the amount of travel they put on daily is just, we just can't thank them enough for all that they do.
It takes a really special person. Kristie, now your office, Kristie, is the only one so far that has switched to this model, correct?
Correct. So we had, Bayada is a very large company, obviously across the entire United States and even internationally. And so we had actually worked our little office there out of Blairsville to be the largest office in all of Bayada in the company, which is a huge feat. And so, we decided that, being as large as we were, that this was something that we could try. We have a really strong office team, and we felt like they were up for the challenge to be the first office in the company to try this new model.
I would think as well that when you're talking about the complexities of the care that you have to offer, that your folks have to really have intensive training and ongoing training.
Yeah, definitely. I mean, we pour our heart and soul and a lot of time into just training our field employees. We actually, in our Blairsville office, have a high-tech simulation lab. So it actually, when you walk into the lab, it looks like a child's bedroom. So we have it set up just like you're walking into their room in their home. And we have a mannequin that is high-tech. She's hooked up to an iPad, and she can do all of the different things that they may encounter when out on a shift. Because, again, they're providing one-on-one care. They don't have a physician that they can page that's in the building with them or a respiratory therapist. They're in the home on their own. And sometimes, most of the time, the families aren't there either. So if the child starts to have issues or problems, they have to be able to react in an emergency. They have to be able to identify if, there's a need to call a physician or try a different medication or modality of care. So we really have to put a lot into training these nurses so they can handle all of those challenges.
We're talking with Kristie Voyda and Kevin Means from Bayada Home Health Care. Kevin, when you think about the pandemic and what it has done, not only to our everyday life, but in your case, the very, very specific needs of people who are faced with very, very difficult medical challenges, I would guess, and you can tell me if it's true or not, that the demand has really increased because people just can't be placed in certain facilities. They can't do the traveling that normally they might do for their medical needs, and so that makes you folks especially crucial to their survivability.
You're exactly right. We have definitely seen an increase, especially over this past year with people that need the care. We try our best to, staff every case as quickly as possible. And Kristie talked a little bit about, how we go about that. But through this whole COVID time, we've tried to be very upbeat and very positive. Sure, our side of the business that I'm managing right now, we provide a lot of care in the schools, so it has been affected a little bit depending on, especially back in March when the schools closed down. But what the insurance companies are doing, they are, allowing us to also, if it's a school-only case, they're allowing us to also go into the homes to provide care as long as the families are willing to let us do that. So, the insurance companies have really been on board with us also to make sure these kids are getting the best care possible.
We're coming toward the end of our time together. I wanted to give folks a chance to learn more about you. Kristie, what are some of the resources out there for folks to learn more about what Bayada does and what this whole general leaning of what you do is going?
Sure. So they can absolutely visit our website, bayada.com, www.bayada.com. Our office is located in Blairsville. The easy phone number to give us a call, 724-459, all zeros, So super easy to remember. If you think, you may have a loved one who could qualify, we also have an office right next to us that provides adult services. So even if it's an older family member or a child, just give us a call. We'll talk you through it. We'll tell you, what we think. We also are very big on our Facebook page and social media. So if you go to Facebook and you just Google Bayada, you'll likely find our Bayada Pediatrics Indiana County page. And we really keep it up to date with everything that we're doing to recognize our field employees. And like Kevin said, to really just keep a positive, upbeat experience for them each day throughout this past year.
Kristie Voyda, Kevin Means, thanks so much for being with us today. It's been informative.
Thank you.
All right. Thanks for having us, Todd. We appreciate it.
Have a great weekend.
You too.
You too.
It is the voice of Indiana County, WCCS 101.1 FM, AM 1160.
This Veterans Day, the Rischini Group asks you to stop and count your blessings as Americans. They salute the sacrifices made by American men and women in defense of our nation's liberty and freedom, especially our local servicemen and women who will not be home for the holidays as they selflessly and courageously serve our country. This Veterans Day, please take the time to remember those brave men and women who help to provide our citizens with the freedoms that we have and who help to make this nation great. Brought to you by the Rischini Group.
On Unite Wednesday and Rick Unite Wednesday and Rick